testing is used to identify those who may have become infected. When there's an outbreak in a congregate care setting or a workplace, staff and residents with the closest contact are tested. But depending on the scenario, individuals on one floor or the entire building may well also be tested as part of disease control action. Second, ongoing surveillance testing or targeted campaigns occur for congregate settings. So CRIC and Ottawa Public Health are taking a risk-based approach so that the congregate care settings that face greater challenges to infection prevention and control will complete testing more frequently. And this frequency and approach will be further defined by the province as well. Ensuite, le dépistage de surveillance continue s'effectue dans le milieu collectif. Le Centre de commande des incidents de la région sanitaire de Champlain et SPO s'appuie sur une approche fondée sur les risques de façon à ce que la fréquence de dépistage soit plus élevée dans le milieu collectif où il est plus difficile de prévenir et de contrôler les infections. And the last category of testing is for the broader public that may be at risk for infection with COVID-19. En fait, le dépistage s'adresse aux membres du grand public qui pourraient présenter un risque d'infection à la COVID-19. So people who have COVID-like symptoms are a priority for testing as soon as possible after those symptoms appear. And the testing of more asymptomatic people may also provide information about the geographic distribution of infections in our community and hopefully help us to identify sources of exposure in the community, again, to stop transmission. Les personnes qui montrent des symptômes comme ceux de la COVID-19 sont testées en priorité, le plus tôt possible après l'apparition des symptômes. Par ailleurs, le dépistage d'un grand nombre de personnes asymptomatiques fournira davantage d'informations sur la distribution géographique de l'infection et permettra d'identifier les sources d'exposition dans la communauté pour ensuite déterminer les mesures nécessaires pour arrêter la transmission. So any Ottawa resident who feels they need a test, even if they're not showing symptoms, can present for testing. In addition to the COVID-19 Assessment Center and care clinics, some family medicine offices are open and providing this service, and mobile services are available for populations with need by referral. Ottawa Public Health still recommends using the COVID-19 self-assessment tool if you're worried that you have been exposed to COVID-19 or have symptoms. And now that we're opening up more workplaces, Ottawa Public Health is encouraging daily screening of everyone working in a workplace as people come in to ask if they've had symptoms of COVID-19, such as a fever or cough or sore throat or cold symptoms. And symptomatic people should go home. They should self-isolate and they should seek COVID-19 testing. So these tests are currently being turned around in about a day. Screening tools are available on Ottawa Public Health Business and Workplaces webpage at ottawapublichealth.ca. Il y a des outils sur notre site web santépubliqueottawa.ca. So Ottawa encourages individuals to seek medical care if you're feeling unwell through your regular channels. Try to contact your healthcare provider. And I'll pass it over now to my colleague, Dr. Brent Malachny.
Great, thank you. Thank you, Vera. As we adapt to living with COVID-19, controlling the rate of transmission and the number of cases will help keep this virus under control. Only a few cases at the beginning of the pandemic in Ottawa required us to ramp up public health measures. At that time, the number of infections were doubling every 3 to 4 days. Until there's a vaccine or an effective treatment, while there's COVID-19 infection in Ottawa, public health advice includes practicing physical distancing, hand hygiene, wearing a cloth mask when physical distancing is not possible, and limiting your contacts. All these measures are going to be part of our new normal. With the arrival of warm weather, businesses are reopening and more people are going back to work. This is good for our mental health and the economy, and we need to be wise with our actions as we continue to live with COVID-19. I'm happy to see more people wearing masks when out in public places. This shows that people are getting the message to wear a mask when physical distancing may not be possible. As mentioned, this will become our new normal as the city reopens. And remember, My mask protects you, and your mask protects me. We are following the provincial framework to reopen, which includes monitoring 4 dimensions: virus spread and containment, healthcare system capacity, public health behaviors, and testing and tracing capacity. Nous respectons le cadre provincial visant le déconfinement qui porte le suivi des 4 dimensions: la propagation et l'endiguement du virus, la capacité du système de santé, la santé publique, et le dépistage suivi. Questions are arising about what is permissible and what is not as provincial orders change and many provincial restrictions remain in place. Please continue to use the principle of protecting yourselves and others as you choose activities. Examples of high-risk activities include having guests over, going to crowded places, and participating in team or contact sports. Low-risk activities include going to less crowded beaches or parks, enjoying a hobby alone like bird watching or stargazing, or shopping online with home delivery or curbside pickup options, and preferably locally. I know Ottawa is a resilient city. We've been through challenges before, and we've always worked together to address them and come out on the other side. Thank you.
Thank you, Dr. Malakji. Please go ahead, Mr. Chenier.
Good afternoon, everyone. Bon après-midi à tout le monde. So we've had another fairly warm week with a bit of a heat wave this week, and it's given us a real appreciation for our local parks. In particular, one park, Mise Bay, has become a very attractive location for people to go. And because this summer is not a totally normal summer with COVID-19 amongst us, we are concerned about considerable risk of gatherings in those parks. But as many people head to Mise Bay, the more people using the park, the greater the risk to maintain the greater risk to maintaining proper physical distancing. Puisque de nombreuses personnes se dirigent vers Mise Bay, plus il y a de personnes qui utilisent le parc, plus il y a de risque de maintenir une distance physique appropriée. Keeping 2 meters apart is and remains our best defense. This week, many people flocked to Mise Bay during the heat wave and were observed in groups of more than 5 and not maintaining physical distancing. We've received numerous complaints, and by law, and our park ambassadors have been in the park trying to address the situation as quickly as possible. The risky health situation was quickly resolved this week, and our park ambassadors continue to be on hand to answer questions and concerns. And bylaw services and police have begun regular monitoring of the park to make sure that everyone is safe and enjoying the park appropriately. And today we wanted to make everyone aware that we've added another feature to ensure that you can sit on your blanket or lawn chair and enjoy Mise Bay this summer. This morning, we painted physical distancing circles in the grassy areas of the park. Each circle, which provides an all-around 2-meter distancing from other park users. Now, the circles are approximately 7 feet wide and about 12 feet apart from each other that provide ample distancing from your neighbor in the park. Ce matin, nous avons peint des cercles de distance physique dans les zones herbeuses du parc. Chaque cercle offre une distance de 2 mètres autour des autres utilisateurs du parc. The use of physical distancing circles, of course, is not new. You may have seen them in the media in large parks in New York, San Francisco, and more recently this week in Toronto. Now, when you come to the park, put your blanket or chair in an unoccupied circle and feel secure that you're at a safe distance away from others. This is an experiment, a pilot project to see if they help people practice physical distancing. If a circle is not available, of course, please keep walking and find a safe place to occupy in the park. I can say that even though we completed these circles at midday, already this afternoon, they have become very popular, and we've noticed quite a few people sitting in the circles and maintaining proper distancing. We ask that when you leave the park, Be sure to not to leave your garbage behind. With the crowds that we'll be receiving there, it's much appreciated if people can help clean up after themselves. And when you're using any of our city parks, please ensure that you practice physical distancing, avoid touching your face, and wash your hands or use hand sanitizers. And remember that sports fields and courts are for casual use only, no teams or group play, and no contact sports. Remember to be respectful and mindful and kind to others. We need everyone's help to prevent the spread. N'oubliez pas, soyez respectueux, attentifs et gentils avec les autres. Nous avons besoin du soutien de tous pour aider à prévenir la propagation. Merci and thank you.
Merci, Mr. Chénier. Last but not least, Dr. Manuel, please go ahead.
Hi, everyone. I just have 3 points, 2 updates, and just one example of what the models show us. So first, we're still seeing really substantial risk of increased transmission or increased growth if we're not careful. So the so-called sort of second wave. We're really on that kind of cusp where we're seeing reduced cases, which is great, reduced hospitalizations, but it's just a small, slow, gradual reduction in cases. So as we open up, there's going to be this pressure to people may be coming more in contact, and if there are, that's going to cause increased transmission, and we're at a substantial risk of increased cases. Once they start increasing, it's sort of the same exponential growth that we've been concerned about since the beginning of March. So that's the first. Second, that said, we have been seeing a decrease, but we're still seeing new hospitalizations even this week, and new ICU admissions. So I think for a lot of everyone, like you heard Dr. McLaughlin talk about, one of the main aspects is maintaining healthcare capacity and also having as small possible impact on health and health from a broad population perspective, but also sort of those severe cases that end up in hospitalization, ICU, or die. So we're still seeing these, and so we're opening up with still transmission in the community, still people coming to the hospital, albeit at a lower rate. So there are, I don't want to, I want to be that balance between sort of optimistic and cautionary on this. The third, and we've updated our website where we do the projections at 613covid.ca to show some of these examples about this chain of transition that we see in these when we do the models. And here's sort of an example. Like you might have a group of young friends that are thinking about having a bigger social circle, and they may say, we're at low risk of having complications, and we may even be low risk of getting disease, and we're just a small group of friends. But where the COVID gets tricky is that what happens if that young group of friends has someone they're living with that's at high risk of getting disease, that they work at a long-term care facility or something? And what if another friend of that small group is living with their grandparents that's at high risk of hospitalization? Now you've got these potential chains that go from someone who's high risk of developing disease to high risk of complications, and that sort of chain can move very quickly, with those young people potentially being asymptomatic when they get sick, so they don't even know they're sick, and they're transmitting to someone who's vulnerable that could end up in hospital. So these are the sorts of chains and this rapid growth that really is concerning when we see these models. So from a modeling perspective, this is why we're these advices that the Ottawa Public Health is giving about being very careful and being very smart when you're distancing, you're starting to reopen. It's hard for you to know the person that you're talking to. Maybe they have someone vulnerable at home, or maybe that they're high risk of having infection. So these chains can develop very quickly and be very difficult to identify, and can cause these localized outbreaks or more than that. So those are my only points, and I'm happy to take questions about any of those.
Thank you, Doctor. So in the interest of time, I will quickly read through the list of media who have registered. No need to indicate if you are present. However, if I missed your outlet, please speak up after I am through the list. Pour gagner du temps, je vais lire la liste des médias qui se sont inscrits. Vous n'avez pas besoin d'indiquer si vous êtes présent, sauf si je n'ai pas nommé votre organisation. Alors, 104.7 Outaouais, 1310 News, CBC News, Ottawa, CTV Ottawa, Le Droit, the Ottawa Citizen, the Ottawa Sun, Radio-Canada, Rogers Television, TVA Gatineau, and your community voice. Have I missed anyone? All right, I will now invite each agency in alphabetical order to ask their question. Please remember you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique. Chacun pourra poser une question et une question de suivi. Alors, on commence avec 104.7 Outaouais, Olivier Beauregard. À vous. D'accord, Olivier n'est pas avec nous. Alors, 1310 News, Chris Curtis. Please go ahead, Chris.
Thank you. Good afternoon, everyone. We've heard that some residents that there are some safety concerns with asymptomatic residents who are looking to go get tested. Dr. Etches, I was hoping you could talk about what kind of safety measures are in place at care clinics and assessment centers.
Thank you. The concerns, I'm not sure exactly what you're speaking of, but if it's about asymptomatic people who aren't sure they're infected, are trying to go to the assessment center to be tested, and they're worried about maybe coming into contact with people who have symptoms, I could imagine that might be a concern. So our partners who run the assessment centers are responsible to make sure that there are social or physical distancing measures in place. And so that would include in any lineups, if there are lineups to be tested, as well as within the centers. So the hospital partners who are running these centers do have infection prevention and control expertise, and they have set up the flow of people so that there is safety in how people move through the centers, and they're using the personal protective equipment and the cleaning practices that are required. So my understanding is that we have not had any concerns raised about their infection prevention and control practices. But if there's a specific situation, I'm always happy to take that offline or address it.
Perfect, thank you. And just my follow-up would be for Dan Chenier. You mentioned that there are some circles now up at Mooney's Bay. If you see that there are other parks that seem to be some congregations of people, will you think about putting circles in those parks as well, or is this something that we just want to start here at Mooney's Bay?
Thanks, Tris. The Mooney's Bay circles are a pilot project just to see how they're received, how effective they are. We have park ambassadors and bylaw in the park observing how they are received, whether they're being used, and whether they assist in physical distancing. Mooney's Bay was quite an issue earlier this week during the heat wave, and especially on the strip along the waterfront. And so we're trying that. It seems to have had some success in other municipalities. And if it works and it's effective here, then we will look at some of our other busy parks, the ones with the beaches, for example, to apply it there as well.
Thank you.
Great, thank you. Now for CBC Ottawa, Natalia Goodwin. Natalia, please go ahead.
Hi, thank you. Good afternoon, everyone. Dr. Etches, a question for you. We, as you mentioned off the top of the call about the second death at the Madonna Care Home, what do you think needs to be done there to prevent another death where it's the first of a second death of a worker in the province? Do we need to look at the province taking over that home? What do you think about that?
Oh, my team is involved in homes that have outbreaks, and the homes that have been flagged as having a real challenge with disease spread within the home, staffing issues, challenges with infection prevention and control practices have had hospitals paired with them, and that has been making a difference. What we know is there are a few homes in our community that have had trouble exiting from their status as red homes, where we just haven't seen the transmission end. I can say that this person who passed away was infected much previously, like many weeks ago. So this isn't a problem with recent transmission of infection in the home. The home's practices are improving, and things are progressing. What we are doing is working with the regulator of the homes, the Ministry of Long-Term Care's inspectors, just to take a look at if there's anything else that needs to be done. And those are conversations that are continuing.
Okay, thank you. And my second question is dealing with the potential of the regional reopening, as Ford mentioned today. Could you see Ottawa reopening faster? And if that happened, how would you sort of work with the neighboring health units that are showing even lower numbers? Like, could you see a regional reopening, or how do you see that happening?
Yes, so I haven't yet had a chance to hear in detail what the Premier was discussing today, or what that might mean specifically about the approach to regional opening. My understanding is that there's some acknowledgement that may be a way forward. To me, what my colleagues and I have been thinking about across the province and discussing with our Chief Medical Officer of Health is that if we have a consistent way of measuring, we're all looking at consistent indicators of what is the impact of COVID-19 in our communities, then we can use that to identify different results, and then take a look at according to those results, what action do we need to take in our local jurisdictions. So I think that may be in line with what the Premier is discussing, that we need some guidance from the information on the ground about the risk, and then we would follow still the provincial framework, the provincial orders about what is legal, what is possible. We're going to continue to operate under that framework. That makes sense. But so there's more to come, I think, is the bottom line. Like we need to understand what that means for regional variation based on the local risk.
Okay, thank you.
Thank you, Natalia. Josh Pringle with CTV Ottawa. Please go ahead, Josh.
Thank you very much. Just following up on that question, Dr. Etches, what would we need to see in terms of cases, in terms of hospitalizations, before you would consider allowing more things to open up if you were allowed to go through a regional reopening of the economy?
So I point you to our dashboard because our dashboard, like the provincial framework, follows the measures of virus in our community, our health system capacity, our public health system capacity, and our testing and tracking capacity. And all those elements are important. So there's no one measure that is ever going to reassure me or make me concerned. I'm looking at the picture altogether because we need all of these things to be able to handle a rise in infections in our community, or keep the level at a manageable level for our healthcare system. So collectively, we want all of these areas to be showing capacity and progress. I do want to see what the impact is of what we're doing right now, right? Going back to work, opening up stores. I need to know 2 or 3 weeks out what are the figures based on more interactions now. So it's like I can't make a quick decision about the level of concern in our community because it takes some time for incubation period to pass, for the infections to go up. I think Dr. Malachy and Dr. Emanuel both mentioned it doesn't take very many cases to start them doubling quickly, and then we'll start to see more hospitalizations. But it does take some time in the early days because the numbers are low to start to pick that up, and it can take off very quickly. So I guess maybe that conveys to you that there's no no likelihood that I'm going to suggest we need to move more quickly right now. But it over time, if the trends continue as they are, then that would be very positive. It's just that we each still have to remember that it's our actions that are determining this trajectory. And it's really important for each of us to continue to maintain distance between people, because that's what's given us success so far.
According to the Toronto Star, 34 health units all support the regional opening. Would it make sense, instead of just having an Ottawa regional opening, to go, say, all the way to Kingston and have Kingston and all of Eastern Ontario reopened, so you make sure everyone's on the same page?
Yes, I think there's been some misunderstanding about the actions of local medical officers of health in trying to promote consistency in what we measure. This is in support of the province. It's been discussed with our chief medical officer of health. It's really about being able to have a common language for communication with the public, and so that those measures that we use already look different between Kingston and Ottawa. I don't think Kingston has any cases showing up. So it's a difference. I think they would be a different color code if they were using the same color code system that we are. So no, the East is a huge geographic area, and it's quite likely that people will need to take different precautions across different parts of the East.
Thank you. Have a great weekend.
Thank you. On to le droit, Julienne Paquette. À vous.
Oui, Dr. Manuel, just a quick question. You've mentioned that if indeed there was a second wave, it could start back as quickly as we saw at the beginning of March. I was just wondering how would the fact that some people have been infected already, and there might be some immunity to the virus. So how would that impact this rate of infection?
You're right. The more people that have been through, the less sharp the peak would be, or the less it would go up. I think our concern is that partly, like we've been so good at controlling it, that there's still a tremendous number of susceptible people. We've been having discussions and trying to estimate that number. It's a bit difficult because how we've detected, done our case testing has changed over time. The large number of cases in long-term care has been kind of outbreaks within outbreaks make it more challenging. But I think a lot of these estimates we're still coming up with very low numbers, like 1%, 2%. So that's not enough to really kind of dampen the amount of wetten the kindling in the forest. The forest is still extremely dry, and that level won't have any substantial reduction in the peaks or their chance to recurrence. So that's why we're saying that we're basically kind of back in the beginning of March, or at the end of March. We're still seeing cases sort of around the end of March.
Ma deuxième question, ce serait pour Dr. Etches. C'est une simple clarification, en fait, sur les statistiques dans la mise à jour d'aujourd'hui et le décès d'un employé chez Madonna. Est-ce que ce décès-là n'était pas compris dans la mise à jour d'aujourd'hui? Est-ce que c'est parce que c'est arrivé très récemment, avant la dernière fois où on a vérifié les chiffres, ou si c'est parce que c'est un résident d'une autre municipalité de qu'Ottawa?
Je n'ai pas lu les chiffres pour aujourd'hui dans notre document aujourd'hui, mais je pense que malheureusement, il y a un décès qui n'est pas dans la liste. C'est souvent que les maisons, pas souvent, j'espère, non, mais quand il y a un décès d'un employé, c'est le cas que peut-être la maison partage cette information avant que c'est dans notre chiffre, parce qu'on utilise système d'information de la province, ça prend temps d'avoir un record pour toutes les normes d'être là. Mais je pense que le point que j'ai mentionné en anglais, c'est que cet employé était infecté quelques semaines auparavant et c'était juste récemment qu'elle est décédée. Est-ce que ça répond à votre question?
Oui, mais juste essentiellement, si je confirme, vous n'avez pas il est probable que ce soit parce que c'est annoncé depuis que les chiffres ont été colligés, mais vous n'avez pas la confirmation. Ça pourrait encore être aussi parce que c'est un résident, par exemple, de l'Est ontarien.
Oui, c'est possible que la maison ait partagé l'information et notre rapport est créé auparavant que nous avons eu l'information, oui.
OK. Parfait, merci beaucoup.
Parfait, merci Julien. Up next with the Ottawa citizen, John Willing.
Hello, thank you. Hi, Dan Chenier. A question about the circles at
John.
Mooney's Bay. Mooney's Bay, do any enforcement measures come with the new circles? For example, is bylaw being instructed to watch these circles carefully? And if so, issue any tickets?
There are no new measures, John. The maximum 5 people gathering continues to apply. But what bylaw will be doing is just, as will the park ambassadors, is just providing a general indication of whether these are effective in keeping people apart. But there are no new specific enforcement measures to the circles. There are no specific rules to them. The overall public health directives in terms of gatherings and keeping distances still apply. These are just kind of visual clues to help people distance themselves, and they're also, because they're so visible, a good reminder that distancing is important in the park.
Thank you, Dan. My follow-up question is for Dr. Etches. Doctor, I'm sure many organizations in the city want specific advice about their workplaces, about how to bring people back. I'm wondering if you're getting a lot of those requests from organizations, and how does your team deal with those requests?
Yes, if you don't mind, I would pass this question over to Dr. Malaki, who is leading basically a post-peak pandemic plan and the response to many inquiries. It's a very busy team right now.
Great, thanks, Vera, and thanks for the question. So I would say it's multi-pronged at the moment. So we have some outreach activities where we're regularly meeting with business groups to hear about what their issues are, and we actually plan on doing more of that to hear what questions they have. We announced about a week or so ago a toolkit that we partnered with the city on for reopening. And that's really a good starting place for any business or organization, because it provides the key considerations and links to sector-specific guidelines. Sometimes organizations have additional issues or questions, and so we have a central intake through our liaison group where we sort of look at the requests and triage it and do our best to align the request with existing guidance so that people can self-assess. We're feeling that having people think through the implications of distancing and what are they going to do about vulnerable staff, how will they manage workflow because they know their operations best, and then come back to us to say, listen, we've thought about it, we have some questions or some issues of clarification, can you help us out? So we're doing that kind of work. And one other thing I would add is we sit on a number of city and business committees to just secure about what issues are and provide advice on an ongoing basis.
Thank you, Doctor.
Great, thank you. We have Taylor Blewett with the Ottawa Sun.
Hi, my question is for Dr. Etches. With the news of the second death at the Madonna Care community today, I was looking and realized that all of the deaths of our local healthcare workers from COVID-19, they have been PSWs. I'm wondering, what's your message right now to people working in this particular job here in Ottawa? And do you feel there's more that needs to be done to protect PSWs from COVID-19?
Thank you. Yeah, I want to say thank you to the personal support workers who are caring for people every day in many settings, whether it's in the home care setting, in a long-term care home, a retirement home, in hospitals. This is a key role in long-term care, and it is essential work that I think people have recognized has been something we need to look at a bit more into the future in terms of the level of pay, the kinds of supports. So we're going to, I think, want to hear more as a whole healthcare system about what we can do to support personal support workers further in the future. Right now, all the focus is on making sure that they have the training they need, the personal protective equipment that they need, any supports from management. So this is, the responsibilities of the long-term care operators, the hospital staff that are in there supporting, have their well-being, is top of mind. And we just, encourage people, if they're seeing something as a worker that concerns them about their health and safety, just raise that with your supervisors. We're certainly, we're all working hard to try to prevent this kind of outcome.
And as a follow-up to that, at this particular long-term care home, the Madonna, we have seen some of our local members of provincial parliament say that they would like to see the province step in and make changes with regards to the management of this particular home. Is that something that you feel is necessary at this point and you plan to communicate or have communicated to the province?
We haven't communicated specifically that we think any homes management needs to be replaced. What we are doing is keeping in contact with the long-term care home regulators, the inspectors, to let them know about the situations in homes, and to have conversations about where, if there are still points of concern, there are things if they still need to be improved. And then it is I think a matter for the regulator to decide whether or not management needs to change.
Thanks so much.
Thank you, Taylor. Maintenant, nous irons à Boris Roux avec Radio-Canada. Boris, à vous.
Oui, bonjour. Certains collègues ont posé la question de la province qui parlait de déconfinement régional. Ma question est pour Dr. Etches. Que pensez-vous d'un déconfinement régional de la région d'Ottawa ou de les régions de l'Est ontarien?
Oui, j'apprécie l'évolution dans l'approche et l'intérêt d'utiliser l'information concernant la situation locale pour informer les mesures qu'on a besoin d'utiliser dans une locale. C'est une grande région, l'Est de l'Ontario, c'est beaucoup de géographie. Alors maintenant, si j'utilise les mêmes mesures, les mêmes indicateurs comme le nombre des cas, les hospitalisations, je peux voir quelques différences dans notre région, par exemple entre Ottawa et Kingston. Alors, c'est important de comprendre plus quelles sont les idées de la province. Quand on dit on va avoir une approche régionale, j'imagine c'est important aussi de considérer comment nous sommes connectés, parce que en voyage entre les différentes régions, il y a différents routes de travail, des entreprises qui sont connectées. Alors, on verra et discuter l'approche avec mes collègues dans la région.
Et si vous permettez, j'aimerais aussi vous poser une question sur ce centre Madonna. Je vous ai entendu en anglais dire que les travailleurs ne sont pas nécessairement assez valorisés, n'ont pas nécessairement une une paye correspondant à leur travail essentiel. Pouvez-vous me répéter ça en français? Quelles seraient les approches que le système de santé doit prendre par rapport à ces travailleurs-là dans le futur?
Je pense que j'ai dit en anglais que c'est important de reconnaître l'importance de le travail de chaque rôle dans le système de la santé. Et oui, c'est les personal support workers qui a un rôle essentiel et ils ont besoin de notre soutien. Et c'est une question pour l'avenir, comment on peut soutenir ces postes comme ça, mais maintenant, aujourd'hui, c'est une priorité de protéger tous les travailleurs et de donner l'équipement, les matériaux, l'entraînement qu'ils ont besoin. Et ça, c'est la priorité pour les gestionnaires de les maisons et aussi les partenaires dans les hôpitaux qui aident.
Merci.
Parfait, merci Boris. Nous irons à TVA Gatineau. Louis Charles. Oh, je pense qu'il n'est pas là. Alors, we'll go to your community voice with Patrick Lucioni. Go ahead, Pat.
Hi, my question would be for Dr. Etches. You've increased the COVID testing to people that just want to get the test, and they're not necessarily symptomatic or working in high risk. Can you see the day this jurisdiction or the Champlain district goes to antibody testing?
Certainly, yes. So our testing strategy in Ottawa is jointly created by the Champlain Health Region Incident Command, our healthcare partners that run the testing centers and the laboratory, and Ottawa Public Health. We're informing the strategy with our data and the public health priorities. The plan, the overall testing strategy includes some research and innovation and using the serology tests as they become available to learn more about the infection in our community. And, it includes trying to push ahead with different methods of providing the test, mobile things, booths. We're going to see what we can do to make it more accessible across the region. And it will continue to evolve and use the tools that become available, such as new forms of testing.
Thank you. My second question is for Dan Chenier. Dan, I think I've asked you this question every time. Are you getting any closer to knowing what your decision is on summer camps?
Well, we still don't have a provincial recommendation in terms of going ahead with the camps. We are looking at communicating out to our current registered families to give them direction in terms of the services that we might offer starting in early July and how they will be modified, because we're pretty sure that the traditional camps that we would have offered that included every kind of sport and bus trips and going to various attractions will not be on, that we will require a considerable modification to both the types of activities and the precautions that we take with the children in our care. And so we're about to communicate that to our clients so that the expectation in terms of the actual experience, should we be allowed to offer it, that they're aware that it'll be altered significantly for this summer.
Great, thanks a lot.
Great, thank you. That's all the time we have for today. C'est tout le temps dont nous disposons aujourd'hui. Thank you for joining us. Merci.